Each year in the United States, 25,000 children are born with heart abnormalities. Some are not serious, but others require surgery or even a transplant. As Dr. Aijaz-Hashmi of Desert Regional Medical Center in Palm Springs explains, many of these defects can be detected even before birth.
Congenital heart disease is a term used to refer to a large group of conditions in which the heart is developed abnormally. These include the conditions such as holes in the heart, tight or leaky valves, or misplaced or missing blood vessels. These conditions are present from birth, hence it's called congenital, but they are not caused by birth. The incidence of congenital heart disease in the general population is about 1%. So that is to say, if you have 100 babies born, one of them is likely to have congenital heart disease. However, if a family has had one child with congenital heart disease, the chance of having a second child increases somewhat. I see some patients when they're still in the womb with severe heart defect, and we start counseling the family about this, what to expect at birth and after birth. And it really depends on the severity of the lesion. The more the severe lesions will present immediately at birth. Minor lesions will present later on. Let's say a 3-year-old goes in for a immunization, a well baby checkup, and the pediatrician hears a heart murmur and gets sent in, and we find some minor heart defects. But most of the severe defects, the patient will have some sort of symptoms and will present very early on. The best way to detect if someone has heart defect is for the physician to listen very carefully to the heart for abnormal heart sounds and murmurs, and then an echocardiogram can be performed, which is an ultrasound looking in detail at the heart structure and function, which is a very, very sensitive test to detect the presence of congenital heart disease. Fortunately, most of the most common congenital heart disease that we see will improve on their own. For example, small holes in the heart are the most common congenital heart disease that we see, and most of these will just close by themselves with time without any intervention. Some defects require treatment with medications. Other defects, such as tight valves or now small holes in the heart, can be closed with balloon surgery or by inserting small devices that can fit through catheters or tubes, which can be placed in the heart and closed. More severe forms of heart disease require open heart surgery, and in the extreme case where a heart is severely malformed and no corrective surgery is available, then we would recommend heart transplant. These small holes that they had when they were born and they closed by themselves, those kids are perfectly normal. You can basically forget that they had congenital heart disease once their hole has closed off. Are there conditions in which they require treatment? Many of them recover completely and lead a very normal life. And of course, the more severe cases, they can continue to have problems and they'll never have a perfectly normal heart. Unfortunately, if a heart is malformed to begin with, there's nothing we can do to make it perfect. We can do all sorts of creative surgery and other techniques to try to improve on it, but we can never perfect on nature.